very simply, the sesamoid bones, two tiny little free bones, they're embedded in the flexor hallucis brevis in the foot. And they act as a major pulley for the tendons. They help the big toe move normally, and they provide leverage, which is very important when the big toe pushes off during walking. They also serve as a weight-bearing surface. They help cushion that first MTP. The people who get this generally, and there's different kinds of sesamoiditis. We can have fractures, we can have from arthritis. So I'll cover that in the slides. But there's a big problem often with ladies who are wearing, the 6-inch heels. Because what's happening is then this weight bearing, this cushioning is just being done permanently on that sesamoid, and we can get problems there. So it's subjected to very big stresses, and all the weight of the body going through there on that push-off when we're going through there. So there's all sorts of little things can happen to it. Let me just go straight into the slides. Not too many of those, you'll be pleased to hear. And then what I'm going to do is we'll start treating it. I think what we've got to do is we'll probably find, on the modern software, Steve, maybe you can help me, because my laser is, 7-8 years old. And they did change the software. On the modern software, do they have a sesamoiditis in there, a setting in there for that?
They do indeed, yeah.
Oh, they do? Oh, right. What can you just tell me what they've got there for there?
The actual settings,
Oh, you can't.
Top of my head, I can see if I can find out for you in the next few seconds.
Don't worry too much, but I would probably go with some slightly different settings that they've got there. It'll be interesting for you to tell me what they've got there later.
Fine.
The reason being, again, you'll often find with sesamoiditis, it's quite a chronic problem. It's been going, people, don't get a little bit of pain in there and they come in straight away, and it happens very rarely. And generally, it's become very chronic, and that is going to change your settings and what you're going to do with this. And I will apply my settings, because I don't have a sesamoiditis setting, but it's an itis, and that just tells me everything. But it's not an itis, it's probably more an osis, sesamoidosis, because it is degenerate, and that's the problem going on there. Here we go, sesamoiditis. Treatment with MLS. Again, treat that name sesamoiditis with a little bit of care, because there's usually a lot of degeneration in there. Here's a lovely picture of the foot. This would probably move if I had the right software in here, and it'd probably have you going down and showing you what pressure they will go under just around this area here. But these are actually embedded in the flexor hallucis brevis, okay, which is under a lot of pressure when we take a step forward. Right, what is it? Inflammation of the sesamoids and surrounding tissue. As I said, the sesamoids are embedded in the flexor hallucis brevis tendons. You get pain directly below the first metatarsal joint of the hallux during a load-bearing exercise, and that's what I said. And you have the lady on there, the 6-inch heels. The load is just there all the time, and they have serious problems. But really a big area where you get it is in sprinters, jumpers, where there's an awful lot of pressure going through that area. It's a small percentage generally of your general population will get it, probably 15–20%, but you'll see it much more in athletes. What's it caused by? A number of things. You can get arthritic changes in the sesamoids. With all the pressure on there, they degenerate like every other joint we have. Really, understand this. People say, "Well, I've got osteoarthritis." Well, this is a 6-year-old person telling me they've got osteoarthritis, and I say to them, "If you didn't have osteoarthritis, it'd be pretty strange, because you've been degenerating from the age of 24. It's very clear. It's just a question to what extent is that happening, and are we getting pain with this?" So arthritic changes, you can get some spur formation, irritation of the tendons and the muscles within that area. Osteoporosis, osteopenia, osteoporosis, stress fractures from heavy jumping. You could get a stress fracture from just being on high heels all the time. Osteoporosis, or osteopenia, the bone density is reduced. We've got the pressure coming through that all the time, and these things start crumbling a little bit. Trauma, overuse, high heels. Oh, there they have the high heels. Yeah, dancers, athletes. This is where we see quite a bit of this. And anatomical abnormalities. Well, we're not talking about somebody with 3 feet or something. We're talking about often a very low arch, plantar flexed first ray, which is sticking down to the ground. If you do a Hubsch's test on them, you probably get a 1 maximum and you start getting a load of pain. So anatomical abnormalities. Treatment, what do we do with it? Well, we can use orthotics. We can actually allow a little dip for the first ray if it's already plantar flexed to come down a bit further. You'll know that if it's already plantar flexed, a nice little test is always to put your thumb underneath the underneath the 4 other digits and just see if this moves up and down equally. Then put your thumb underneath the MTP on the first one and try and lift up the hallux. It won't go. If you've got holding up, that will show you if it's already plantar flex. And we've got to make some allowance for it there. And that might reduce the pain an awful lot, but it's not going to sort out everything. You can take oral anti-inflammatory medication, your ibuprofen, etc. Does it really work? It'll have some tiny little effect on the pain. Rest immobilization, that's the one bit I always hate. Yes, we need to, I would much rather change that rest immobilization to changing modification of activities. I hate the idea of rest and immobilization because it's not good. Tissues need to be stressed in the correct way to affect the changes that we really want. Physical therapy, physiotherapies will do various things, and they'll probably often do the help with the orthotics or send you down to the podiatrist. And then we've got MLS Laser. This is, again, this amazing adjunct to what we do. Again, let me explain to you. I say this every time, and let me just declare who I am, because I'm not working for Celtic, even though I'm here talking very glowingly about the MLS Laser. I'm an independent physiotherapist, but they use me because I had one of these long before they got the gig to market this for ASA. And so I've been using it an awful long time. But I say as always, no machine is going to sort out everything. It just doesn't. It's using your head, your hands, all your skills, and then having an adjunct which can actually do amazing things. And we'll have a look at the next slide of what this really can do. But this is an adjunct which is just quite extraordinary. Let's move on. So MLS Laser, what is the advantages and the benefits? Right, it will reduce the inflammatory process. Big problem with sesamoiditis. In the name itis probably gives it away. There's an inflammation, but even if it's an osis or an opathy, there will be inflammation in there, but there will be degeneration as well, and that's where we can help as well. But it reduces levels of pro-inflammatory interleukins and prostaglandins. Basically, on top of its tissue repair, which it's doing by increasing ATP in the body, which is permeating into all the mitochondria, it also gets the anti-inflammatory proteins to bind onto that. And so we get a huge reduction of the inflammation as well, which will help with pain automatically. It will reduce swelling. We can, by changing the effects on here with the levels of Hertz, we can actually increase the mechanical effect of this, so we can start flushing fluids through there. You're getting an increase in heat, but not enough to cause any damage. This is a class 4 laser. It's sending in on the 905 nanometers, it's sending in 25 watts. That is going to cook you. It doesn't cook you because it's super pulse, and that 905 is working on inhibition of pain pathways. Now, what we know is, and we've always known, that a pulsed wave will actually help with inhibition of pain pathways. This is super pulse to a nanosecond on, nanosecond off. Tissues heat, cool, heat, cool. So you're sticking in 25 watts, but the maximum temperature you will get there is 42 degrees centigrade. You'll really start feeling some problems at 43 degrees centigrade, and you'll get tissue damage at 45. It can never go there. It's just totally safe. It's quite phenomenal, and it's sending in all that power. It will reduce pain. It'll increase in endorphin synthesis, but the modulation of the pain stimulus conduction, i.e. this 905 nanometers working on inhibiting the pain pathways. On top of that, you've got the reduction of inflammation as well, which is going to help with the pain. And you've got reduction of the swelling, which is going to help with the pain. So you've got the synergy, these two weights, 808, 905, sent in exactly the same time, synchronized, and you get a synergy from what the two things do. One doing tissue repair, reduction of inflammation, increase of reduction of inflammation, and decrease of edema. And then on the other one, inhibiting pain pathways. So you get this whammy, triple effect, quadruple effect all at once. Biostimulation and tissue repair. This is the one bit which we're talking about. Increases supply of nutrients, oxygen, growth factors, thanks to vasodilation. It's actually thanks to the 808 nanometers starting this protein synthesis, which starts the creation of, as it says on the next line, ATP, activation of the cell functions due to increased ATP and cellular metabolism. It just fires up these sick cells which cannot get any energy, so they cannot do their repair. And now we actually send in we give them a massive charge and we get them working. So, right, why MLS Laser? Right. I put here as well, if there is an arthritic process, which there often is in this chronic stuff, studies have shown that laser, MLS laser can decrease the degenerative process, decrease the prostaglandin level, which we talked about reducing inflammation, increase protein level with a repairing effect. It'll act on the chondrocyte activity. What it will really do, see just below all the articular cartilage on the outside, you've got the bone underneath there. This really stimulates the bone repair, which in turn starts changing the articular cartilage, and therefore improves cartilage thickness. Right, settings for osteoarthritis, this will come into what I'm going to do, but chronic, high frequency or CPW and high intensity. Probably means nothing to you. It will become quite clear. But always remember, when we've got something very acute, we use lower hertz, lower intensity. And when we've got something chronic, we put the hertz up, we put the intensity up because we want to get more power. This will all affect the number of joules which are going in. That's how we measure the power that's going into the tissue. The higher the joules, the more power that's going in there. So in a chronic situation, we want more power. If we put far too much power in the acute situation, we're liable to get a rebound effect where they feel it's probably a little bit worse afterwards. You can always warn them, it'll be back where it was in 48 hours, but next time I'll reduce the power. But you should never really get to that level where you're having to say that, because you go up in increments from what they give you, or if you know it's very chronic, you actually stick it up more, but you probably don't use your CPW. I'll explain that later. It says normally 8 to 12 sessions. I'm not sure how good that is, repeat twice a year. What I like to look at is the 3-2-1. If you can, with a patient who's got the problem, 3 times the first week, twice the second week, once the third week, I give my swing analogy. You push a kid on the swing, goes flying high. If you leave it 7 times, it'll come back virtually to a standstill. This machine is cumulative. It really works on top of itself. So You give the kid a swing, and every 2 or 3 swings, you give it a little push, and the kid is still flying high, and he thinks he's going over the top, and he's panicking like mad. That's what's happening. So 3, 2, 1. I know it's very difficult sometimes, but then certainly try and get 2, 2, 2. And you'll see the treatment times are so short. We can actually we can get them in for half a session, charge them half as much, so they're getting exactly the same for the money. But there is the difficulty of people working. But now in lockdown, well, not in lockdown's finished, but a lot of people are working from home, so they should be able to do it. Right, now, there's something else I want to bring in today because, you know, we're going to set this machine up for treating a fairly chronic sesamoiditis, and it's not going to take very long. There's one other thing which I do use quite a lot in arthritic problems. I use this in osteoarthritis. I use it in rheumatoid arthritis. It's incredibly effective as well. And I get the patients in probably half an hour beforehand, and I stick them on a wonderful little machine, which is a magnetotherapy, pulse electromagnetic fields, extremely low frequency, which has a monumental effect on working on these problems. And I'll just show you that very first. What I'm going to do is I'm going to come over, change the screen. I don't know if you can see that. It looks like an MRI scanner, and that's exactly what it is. It's sending in pulse electromagnetic fields through the solenoid into the tissues. We can get it going just down in the foot or right up the body, and this is where it has massive benefits. Or we can use the flexi pads, which we can wrap around and do a setting on there. Let's just very quickly use the flexi pads. I'll set up for the flexi pads, then I'll show you how this would work, the bed, but then we'll go into the laser. So, just in case anybody's wondering about this, my model is my wife, so that's why we're not covered in PPE and the various products you get. Okay, what I'll do, let's say the sesamoiditis is just on this, this right foot. What I'll do is, I'll get this round the foot here. I'm going to run that round there. And what I'll do as well, a bit like we always love to talk about the global thing, I'm actually going to get a bit of one round here, just to actually increase vasodilation, everything around here. I'll put that up here and put that round. Right, so just relax down there. I'll just come across the machine. It is so simple. I don't know, can you see the screen there? I've got it on osteoarticular diseases. I'm on channel 1 for these flexi pads. All I'm going to do is press in. I'm going to probably leave the hertz at, I might just count time it, 20 hertz. Depends how chronic this is. If it's very chronic, I'm going to go a bit more intensity. She's had it a long time. I'm going to get 80%, 30 minutes, and I literally press start. Oh, actually, what I'll do as well, I'm also going to put a little vibration on there so she knows it's, can feel it's happening. And then we just start that. Okay, start. So I get that going. And then, can you feel something happening there? Okay, so Francis, you can feel that. Okay, and what's happening is we're actually really preparing all these tissues for the laser. Right, I'm going to stop that because I'm going to show you the bed as well we can use. Here we've got the patient here, we've got the sesamoiditis, so we're right underneath there. This will be sending right through this, this solenoid, load of pulse electromagnetic fields. Get the patient to take their watch off. You don't stick them on here if they've got a pacemaker in. What I'm going to do here, I'm going to go back on, I'm going to go to channel 2. Okay, I'm going to go in again. Let's go up hertz, but what I want to do is very chronic. I'm going to go right up here. Oh, how? I'm going to go 90%. Come across here, 30 minutes. 30 minutes. You can have any time you want here. Go right again. Right, now what I'm going to do is, she's got really bad arthritis in her knees as well, and her hips. So I'm actually going to do the whole lot here. So what I'll do is, I'm going to go post 1, right here, post 4, and I'm going to start this. So look what happens here. This is all very, very clever. No glasses needed for anything here. And you can probably see, I'll get these wires out of the way. We've got a very impressive. Now what's great for her, she can actually sit here and watch the telly, if you can see that, but obviously we've got the camera going there. Have some music on and have a lovely time while we do that for half an hour. Just something which is quite interesting. I don't know if we'll be able to see this. You can't really feel anything underneath here. You can't feel the pulse electromagnetic fields. However, if I put this little magnet underneath there, now that, I can't make sure that is going crazy. And that is what's going through the body, the tissues, the bones, everything, and helping them repair. Just to give you the heads up on the on this PMF, what it will do so many different things. It will reduce pain, swelling, especially after surgery. Very useful. It can help heal the bones. It can actually reduce osteopenia, osteoporosis. It can activate lysozyme, major step in bone regeneration process. It's just a pretty amazing little thing. But we've actually really prepared the tissues nicely for what we're going to do here. So what I'm going to do is, if you don't have the Charlie head, you will not have this little handpiece there. That's if you've got the Charlie head. So you can actually set this on whatever you want, and you can set the Charlie head at the same time. But if you don't have that, don't worry. Let's have a look here. Let's go to the feet here. Now you say there's a setting for sesamoiditis. It's an itis. What I'm going to do is, I'm going to just basically use the foot arthritis setting here. Okay? But the problem I've got now is, it's saying 15 points. What I'm going to do is, I'm going to actually bring this, it's a very chronic problem, I'm going to bring it right up. Okay? So I'll press on there, and I'm going to go 900 hertz. Okay? And that will give a little bit more mechanical effect as well. 900 hertz. That will have changed the joules I'm putting through there. I'm going to leave it 5 minutes. I'm going to go, because it's chronic, I'm going to go up to probably 100%. Okay? Now 3.71 joules per square centimeter. But the problem is, 15 points. I don't want 15 points. I'm going to bring this right down to probably about 5. Right. 5 points there. You see the time has changed. I'm going to get this back to 5 minutes. Press on there. 0500. Press OK. And I'll start. Right now, I have broken my #1 rule, which is always treat the global area first. And there's a scan thing on that. I'll show you that afterwards. But we would scan all the tissues first to get some photo biomodulation light in there. Actually start the vasodilation, start putting ATP in all the surrounding tissues. But I'm going to get very locally onto this area now and treat it. When you're using this, make sure you're using the glasses. I'll just, at the end, I want to quickly go through this leaflet which Celtic have handed out. So if you have the laser, you have to read it, sign it, and send it back to them to make sure you're covered. But what we'll do is, we're going to put the glasses on, because infrared light, which this is using, is, you can't see it. You'll see a red thing here, which is just showing you where we're putting it, which is an LED, but you can't see infrared light. That will fly off anything that's metal. It will probably, if it goes into your eyes and you're not wearing your glasses, you can cause retinal damage, even blindness. And that's one thing you don't want. So you just make sure you're wearing your glasses. Right, so 5 points we know, and we're saying, right, really sore in here, yeah?
Yes.
So I'm going to really come right around this area here, okay? Now, I've got this on there, and if I switch the lights up, you'll see it a bit better. Very first time we're doing this, we probably, because she's in so much pain, we can probably keep the foot still. What we like to do, let's bring that over there a bit. What we like to do is actually start getting some movement in here. Now, I'm going to got that on there, and you probably see it's going in that area there. I've got it on there, and I'm going to do 5 points. It will stop each time, and we move it around, okay? But at the moment, I keep it completely still, and we don't have to worry about heat. First time, we've got no major problem, no problem with them not moving because of so much pain. But this works so well, and it will reduce the pain quite markedly. Let's say this was the second treatment, or even the third treatment, definitely. I would start going and moving this toe. Can you bring it down? Okay, and bring it up. And get moving this thing. So we're actually working that flexor hallucis brevis. Keep it going, which is helping with the repair on here. And keep on going. I'm just going to wait for it to stop the first time. You'll see how easy it is. It just stops itself. So it stopped itself, and I'm going to move it to the next point. Now I'm going to get on here, move it out of it, get moving that foot, please. And just keep it on there. And so on. It will keep on going until it stops. Now I'm going to keep it going, and I'm going to go back to the screen. I'm going to show you what's happening on the screen. Right. You can probably see what's happening is the joules are adding up. Okay, we're at 11.13 joules per square centimetre. That's not going to change because we're keeping it steady. But the total joules are adding up. The time is going down, and we started with 5 points. We've already done 1 point, and now we've done the second point. It stops itself again, and we just start it going again. So it carries on adding up the joules, starts counting down the time, and it will eventually get to 0, and it will just switch itself off, and it will sound like this. Like that, okay? Right, very quickly, I told you I'd broken all my rules. The one thing we always do, let's keep it on here, I'm trying to keep today shorter. We always do the global approach first. I would always scan this first. So I just press scan, I'm not going to do it. I'm going to scan. It's this sesamoiditis. It's not really, it's been going a long time. It's not acute. You can see 300 hertz, 25%. We go to chronic, goes up, sorry, 500 hertz, 75%. We can even go up a little bit more because it is a pretty chronic problem, this. And what we're going to do is we're going to scan really largely on the whole base of the foot, on the plantar aspect, and probably not on the talocrural joint, but really in the gastrocs. Loosen up everything down the Achilles and get that all going there. All you do is you start this, press the button on the laser, on the wand, and it's only 4 minutes, 3 minutes 56, it's counting down, it's counting up the joules. You're not getting joules per square centimetre because you're not holding this still, therefore it can't tell you exactly how many joules per square centimetre it is. We're just putting a total load of joules into that whole area. Okay, and that will count down until it gets to 0, and it will just stop. So basically, I've done 5 minutes and 4 minutes, 9 minutes, and I've treated the sesamoiditis in a pretty chronic situation. And then I do my other stuff. One thing, I know we want to be a bit quicker than we normally are, but one thing which I always have to mention is we've done, let's say, the scan, then we've done the pathology. Trigger points, big problem with trigger points causing problems in the foot. Medial head of the gastroc will often cause problems down to that arch area and probably down to the first MTP. So what we do is we look for the trigger points. Right, We're going to check the trigger points everywhere. Anything up here? Got a big problem just here. And me, the head of the gas actually even jumping there. What we can do is we can just set the trigger point setting. We just go on to back here. Just press trigger points. Okay. It says acute. Leave it acute because even if you've got a chronic condition, trigger points by nature are acute. Okay. It says 100 hertz, 20 seconds, 25%. Just leave it there. That's fine. Okay. Press start. And we're going to go back to the other camera. And what we do is we get back in that area where, let's move around. Right there, yeah, a little bit sore. Medial head of the gastroc, as I told you. And that will often refer pain right down into this region here. And you can be involved with that, that problem. So let's get on that trigger point. We just hold it there. Let's spin that around. So it's on there, 20 seconds. 20 seconds is a long time. Retesting that trigger point. Is that as bad as it was? No, it's not. Probably do 2 of those on there. Find any other trigger points, treat them, and after 2 or 3 of those, it will have gone completely. At 20 seconds, it's quite phenomenal. Okay, another 20 seconds, and it stops. Okay, pressing that, what's that like?
Better.
Much better, right. Okay, just on the final thing I want to show you, because I want to finish early, it is this, using that same setting, but changing it a little bit. We've just treated, we've scanned around the surrounding tissues. We've done the pathology setting on the sesamoiditis, on the sesamoid bones. We've done the trigger points. We go back, press the sesamoid bones area, and we get a bit of movement of the hallux, and they say it's still bloody sore. Okay, here's a little bit of magic. It should be a lot better straight away, but here's a little bit of magic. What we do is we just change the setting here. This isn't for a trigger point. This is, we're going to use the trigger point setting, but it's for a very sore area. Works very nicely. I'll just get onto here. Right, we're on here now. Where's the pointer? Okay, let's get off here. Bang. Right, we're going to trigger points, acute trigger points. Okay, as I said before, comes up 100 hertz, 20 seconds, 25%. What we do here is just press on the 100. Oh, press on the 100, change that to 10. Okay, 10 hertz. It doesn't matter about that. I'm going to have to change that because 10 hertz. Okay, 10 hertz, 23 seconds. Don't ask me why it's 23 seconds. The Italian said it is. Get up to about 75%. Okay, now we press start again. Going to come over here to the patient again. Okay, and remember what I said to you. We've gone back in here and pressing in here, and it was bloody painful still. So what we do is, I can feel this. We're just going to get this on here. And press that. You can probably see it's virtually flashing. Okay, the very, very acute setting. We'll put that on there, 23 seconds. And this is actually pretty clever because it does work. 23 seconds. It's a long time, 23 seconds. Stops, kept pressing in there. What's it like? Is it better?
Much better.
Much better, yeah. And probably do the other side, lateral and medial ones, okay? And so on, okay? So, use that as well. Now, one thing I haven't shown you, very, very quickly, let's go back to here. I said we're dealing with sesamoiditis. I used the ankle, I did the foot arthritis setting, okay. I did the foot arthritis setting, 1.87 joules, but I said, look, this is fairly chronic. I'm going to go a bit more intensity. I also increased this. You'll see it will make a change, but not massively. I changed that to, I think, 900. Just get a bit more mechanical effect. It goes up a tiny bit, not much. But the intensity right up here, 3.71 joules. I could actually say, look, I tell you what, let's really whack a load of joules in there and just press the CPW. If I press that, you see that's gone straight to 7.46. Just be very careful with this. That's something you could use if you're not getting any results straight away by sticking in a load more power. But what's happening here, I'll explain in a second. We've actually got rid of the frequency wave. Okay, it's now continuous. If we bring that back, the joules come back down to 3.71. What is happening? Let me explain really quickly. Really quickly. What I mentioned at the start was there's two waves of light. 808 nanometers, which is working on tissue repair, working on reduction of inflammation, and it's working on reduction of edema. That's sent in at 1.1 watts, which isn't too high to cook you, but I said it's continuous, and I said the 905 is super pulse, which it is. Right, the continuous one actually is not totally continuous. It's frequency, okay? But to intents purpose, when it comes down to this, it is pretty much continuous. If I can show you what I've drawn here, when we've got the 808 with the frequency wave, which is the default setting, it comes on and goes off. Comes on, this all depends on the hertz you've got. Comes on and goes off. Comes on and goes off. What's happening? When it comes on, the 905 nanometers is super pulsar. Bang, 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 then bang, 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 then bang, 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 and so on, like that, for as long as it takes. What happens is when we press that CPW, this frequency wave, where it's frequency on for whatever time it is and on, is no longer frequency. As you saw, the frequency box disappears. When you press the CPW, it becomes totally continuous. It's on all the time. And then this is going through all the time. So what happens is just by pressing that button, you literally double the joules straight away up to, as you see, it just doubles it. Now, that is a fantastic tool to have if you've got an incredibly chronic problem which isn't responding. Just be careful about using it the very first time, because if you stick far too much joules through the person, you can get the rebound effect. It's putting too much energy in, and you'll get an effect where the people say, it feels a little bit worse, okay? That tells you everything. You just know, you say, I've been an idiot, I put too much power in there, and take it off the CPW, and put it onto the FPW, and then you can increase the intensity and go up that way. So hopefully that makes some sense. I'm going to finish there. I don't know how long I've gone on for, but hopefully it's not too long. So, Steve, over to you.
Thank you, Paul. For you, not too long at all. I have got a couple of questions. One question came in earlier. So, Claire, thank you for being patient, but it wasn't specific on the sesamoid, so I thought I'd keep it till the end. Paul, can I just ask, on a large swollen knee, can you do a scan and pathology modes, both post and ant, aspects of during the same treatment?
Yeah, you can. But what I would even do beforehand is, if it's very swollen, I'd probably use the anti-edema setting first. Clean out the lymph, just do a little bit of, a minute or so on the lymph, just up into the groin, and then I would start using the handpiece to actually move the fluids away, up from distally to proximally. Just try and push the stuff away. Try and reduce the edema as much as possible, because if we do that, then we have more effect with what we're doing with the laser when we're doing a pathology setting.
Okay, another question come in. Are you using super pulsing continuously with the CPW?
I'm not using that. Is the default. The super pulse is on the 905 nanometers, is just there all the time. The super pulse has to be there because we're using loads of wattage, 25 watts. Some machines have 75 watts. It just speeds up the time of treatments, not equivalent, you know, it's not 4 times quicker, it's probably about 25% quicker. But you have to, because when you're putting that much power in with that light, that width, you will start cooking the person, okay? This is why the system is with the super pulsing, nanosecond super pulse accurately, on for a nanosecond, off. That allows on, off. It allows the tissues to heat, cool, heat, cool. So the most you'll get is a heat up to 42 degrees centigrade, and you're really going to have problems at 43, 44, and 45, big tissue damage, and which other lasers cannot do. So that is just a massive safety thing, but it doesn't affect the treatment, because you're getting all the benefits of the high wattage. So you're getting basically the thermal effects without the thermal damage. No thermal damage whatsoever. So it's a win-win. Now that super pulsing only applies to the 905 nanometers. The 808 is frequenced or constant, whichever you want.
Well,
Okay. Does that make sense?
it does. Yeah, it does to me. Yeah, thank you. I'm sure it does to everybody.
Oh, and just to say, as we said right at the start, those two waves are completely synchronized. So they're happening at the same time, but we cannot change the 905 with the massive wattage, because that has to be super pulse.
So, I mean, it's worth stressing that point, really. I mean, this is what kind of makes this particular laser so different to any lasers that have been out there or currently out there previously. Is this MLS element to it, isn't it?
Yeah, I mean, you see, something like the K laser, which was the big one before you guys arrived, but you know, they're sort of saying they're better. They say they use 4 widths of light, 2 of which are useless. One is 600 nanometers, which is just on the surface. There's a therapeutic window between about 790 and 940, 950. Before that, it's surface. After that, it's surface. And you get the depth in that from 800 to 940. And that's where the widths of light. So what we're getting is we're getting up to 5-6 centimeters deep from surface to the bottom. You're getting all the treatment through that area. What will happen with the 600 hertz is just causing some scatter on the surface. But what they do is their pulsing system is, they say it's pulsed. So it's pulsed in this way: 600, 800, 990, 600, 800, 990, 600, just keeps on repeating that. So what happens is it's actually on for bloody ages in terms of compared to a super pulsing. So when it comes up to 980, once you get to 980, it's just again surface again. It's just causing scatter, and that will start cooking the tissues. And I say to people, you know, you could be on with that K laser, you know, and you have to keep it moving. You can't keep it still. You have to keep it moving all the time. And if somebody walks in the room and you stop, yeah, what is it, mate? And you stop moving it, then you turn around, smoke will be coming out of them. They'll be screaming, and it's not very, very good. So 2 of those widths are completely useless. And the 2 that they have in that region, it doesn't work. They're not at the same time. So you've got one, then the next one, and they're not super pulsed in the same way as this is.
Brilliant. Okay, thank you. And question for me, actually, because I get asked this all the time. And I'd be interested for the sesamoid in particular, whether this would still be relevant. But the whole thing around dynamic, you know, mobilization, getting some movement in there,
yeah,
while you're treating. We've seen that work brilliantly. You've talked about that work brilliantly on things like, you know, the knee, the ankle, the shoulder, so forth. Still relevant in the sesamoid or not so much?
Yeah, absolutely, because they're actually they're embedded in that flexor hallucis brevis. So just by moving it, you're moving it around, and it's actually having different effects at different parts of that that MTP joint. So yeah, I mean, we want to get just for you punters out there watching it for the first time, we really want to try and get some movement in these tissues whenever possible, especially if we're dealing with a ligament, tendon, muscle, anything like that. then we want to get the movement, and that will actually get this working actively as it's supposed to work in the plane it's supposed to work, and that will help with the transfer of energy into those tissues. When we're dealing with an arthritic, major arthritis, i.e. like osteoarthritis of the knee, then we look for the optical window. Understand, the laser cannot go through the bone. So if we want to treat the front of the knee, we're going to have to get into real flexion to allow that laser to open up that joint and get right into that area. And when we're doing the posterior of the knee, then we want to actually go into extension, turn the person over obviously, and we can get into the joints on the back. So any bit of the shoulder, external rotation, internal rotation, just try and bring the thing right across. We can get right deep into that joint, but if we just go on it and we don't move it at all, we're just hitting the bone which doesn't need the treatment, then we're not getting the effect that we really want. So it's knowing your anatomy. It's being the podiatrist, being the physiotherapist, not using your, I always said, use this, use this. That's what makes you a good podiatrist, good physiotherapist. You use these major tools, which are the best tools you've got, but then if you have something else, you want an adjunct which really works, and this thing really works, and that's the benefit. Can I just say one thing, Steve? If I brought in the magnetotherapy because in situations like this can be very helpful. If anybody wants any information on that, don't come and see me. Get in touch with Celtic SMR. They'll send you loads of information on it. And they're the guys to speak to about that.
Yeah, just drop us a line on that, guys. Always happy to share the information on that. We've got quite a lot of background information on that. So always happy to share that out there. But it's an interesting one, Paul. Thanks. That interesting you brought that in, because obviously working alongside the laser, you're obviously seeing even better results again. So that is something else that we do. So that's,
well, yeah, just another thing. I use it on psoriatic arthritis, rheumatoid arthritis, and the laser is fantastic. But I get such major results by sticking them on the half an hour on the bed and then doing a very chronic setting on the laser and putting that through the joints which are the problem, and we get an amazing result.